Lynn, and hello everyone. Good afternoon. Thank you for joining the Ottawa Board of Trade in our first Wellness Wednesday. We're so pleased to have you here, and I want to thank Lynn Ladd from the Ottawa Board of Trade team for organizing this series, something that has become extremely evident over these last 7.5 weeks. I've never kept track of any one thing in my life so clearly in terms of timing, but we are officially 7.5 weeks into this pandemic. And one thing that has become very clear is that as we counter the impact of COVID-19, there are some unintended consequences that are related to the restrictions, which are completely necessary in terms of our mental and physical well-being. And certainly that mental and physical well-being, the resilience of our workforce, of our business owners, our entrepreneurs, and our CEOs is critical to the success of our recovery. And so we're thrilled to be able to bring this presentation to you today and to bring to you this series. And we want to say thank you very much, of course, to our sponsors, the Ottawa Citizen, who is our ongoing community partner, today's presentation partner, and I'll share a little more about our presenter in a bit, but thank you to St. John's Ambulance, our event sponsor here, which is Enbridge Inc. And then I want to say a very special thank you to IHR Advisory Services and our friend Karen Brownrigg for supporting this series in particular. As many of you would know, all of our programs and events are sponsored by our supportive member businesses. And so when Karen heard that we had this new idea, she was quick to step up, and of course very aligned with her own personal and business vision, I know. So thank you very much, Karen, and to IHR Services. Just a little update on the Ottawa Board of Trade. We continue in our mission to create community prosperity through advocacy, collaboration, and leadership. What that has looked like over these last 7.5 weeks is many conversations with our business and community leaders about the most pressing issues facing our businesses today. And as well, working with decision makers and stakeholders at every level of government. First, to roll out the programs that were so needed to support our business community, then by providing feedback, tweaking or evolving those programs so that they have the intended impact, and now starting the conversation about what recovery could look like for us. Many of you are good to stay in touch with us ongoing to help identify those issues and create solutions. And I encourage you to do that either by sending notes to myself, any of our team members, or we do have a special email for COVID-19 related issues called Stronger Together at ottawabot.ca. So I encourage you to use that. Stay in touch with us through our social media, through our newsletters and our website, and we're happy to address any ongoing concerns that you have or update you on what we're doing. So I'm going to first introduce our speaker today, and then I'm going to turn it over to our key sponsor, Karen Brownrigg. So we're so excited today to have joining us as a presenter, Lisa Paul. Lisa, thank you for being here. She is the Director of Learning, Operations and Community Service for St. John's Ambulance, Ottawa. She has varied experience in the fields of policing, business, adult education, mental health crisis work, medical first aid response, and suicide prevention. So that's quite a resume for someone so young. Ms. Paul has served as both civilian and sworn member of Ottawa Police Service, working in Ottawa's downtown and Vanier areas, where she proudly found her passion for community safety, even being awarded the Quartier Vanier BIA Award for keeping the community safe. Ms. Paul ended her career after specializing as a detective in undercover operations, including human trafficking, prostitution, and drug investigations. Her personal and professional journey with mental health led Lisa to her passion of mental health support. Using her pragmatic approach to life, she educates her community as a mental health first aid instructor with the Mental Health Commission of Canada, as is currently an instrumental part of bringing mental health and wellness for the workplace, the newest course from St. John's Ambulance, to Canadians from coast to coast. When not engaged in public education, she keeps her skills sharp as a crisis responder and suicide intervention specialist, supporting Ottawa and many communities throughout Canada. So thank you, Lisa, for being here today. We look forward to your presentation. But at this time, I would like to turn over the floor to our good friend, Karen Brownrigg, who is the owner and principal of IHR Advisory Services, and if I may say, a very supportive member and volunteer of the Ottawa Board of Trade, and has played an integral part in our consolidation and ramp up over the last 2 years. So thank you once again, Karen, for being here, for being such an important part of our business community, and for supporting this series. Thank you.
Thank you, Su-Ling. Before Lisa starts sharing all of her magical secrets, I want to mention that most people don't realize that there are tips and strategies for dealing with challenges around mental health in the workplace. And that there's some tips and tricks that Lisa's going to be talking about today. We all realize the importance of having first aiders as part of our health and safety program. It's mandated according to the Occupational Health and Safety Act. But what people don't realize is that the training that Lisa's team offers the first aiders includes a component around mental health in the workplace. And most importantly, how to spot the signs when somebody is struggling, and then to know the strategy around what to do with that. This is particularly important today, where everything we know to be normal is not normal anymore. So when you're thinking about change management and people navigating through change and all of the various phases of that energy cycle that we go through when we're navigating through change, when we're working remotely, it's easy to hide some of those signs and to just show up and look like everything's okay, but you're really not okay. So I think what Lisa's going to be able to do is shed some light today for us on how to spot those signs. Oftentimes people think it's just the responsibility of a leader to spot those signs. Excuse me, it's all of our responsibility to navigate that and reach out and check in with people. And then I think today's session is going to teach us about how to then take the next step and work through that. So hugely important. We're at the very early stages right now of navigating the waves of change that we are going to be encountering as we engage in that reintegration and that phased in to what we want to call, in quotation marks, back to business or back to normal, or back to whatever we define as the new normal. And as we're going through each of those stages of change, we need to be recognizing that somebody who was okay in the first phase of that change may not be navigating the second phase of that change well, but maybe showing up, looking the same and behaving the same, with some signs that are happening. And we need to be diligent in our approach to making sure that we're continuously tapped in to the people in our personal and professional lives, and that we're checking in with them, and that we're applying the strategies that Lisa's going to talk to us about today. So thank you, Lisa. The work that you do is incredibly important. And the more we know about mental health in the workplace, and the more strategies we have to engage and support people, the better off we'll be as a community as a whole. So I want to thank you for all of the incredible work that you and your team do.
Excellent. Well, thank you very much, Karen and Su-Ling and the team at Ottawa Board of Trade, and Lynn. What you've done today through your sponsorship and your support and enabling St. John, to come and present today. You're enabling us to reach our community into workplaces so that we can talk about workplace mental health and wellness, but you're also enabling us to reach our community with that, because there may be people on the call today that are not necessarily looking at this from a workplace perspective, but maybe a personal perspective as well. So thank you for enabling that. You know, I think that I'm going to keep going on with your analogy there, Karen, that you were using. And right now we are all with this COVID-19 pandemic, I guess, navigating uncharted waters, and they're fast moving. And inevitably, we are starting to see that some people are navigating through this better than others, and some are challenged. And so talking about workplace mental health and wellness is certainly critical, and it's crucial right now. And so thank you all for joining us today. In order to make sure that we have a strong economy here in Ottawa and in Canada, and to make sure that we rebound from this COVID-19 pandemic, we need to make sure as workplaces that we have healthy employees. And I can't help but think at this time, especially, one of my favorite definitions would be the World Health Organization and how they define mental health, or health in general. And the World Health Organization states that health is a combination of physical, mental, and social well-being. And it's not just the absence of disease or infirmity. And that's so crucial to remember right now, because as we go forward, we're looking to have workplaces that are virus-free, which is very important, but we also need to be looking at workplaces that have mentally healthy and well workforces. So what we're going to do today is, you know, we've designed this presentation to speak to the business owners, the leaders, the HR professionals that are with us, and we're going to give some tips and tricks to help our economy and our workplaces respond and recover and thrive post-pandemic. And we're going to give you some simple and easy to implement pragmatic tools so that you can bring these back to your workplace. Now I'm just going to do a screen share here so that you can see my presentation. And so what I'd like to start with is that I really do believe that each and every one of us have a role to play in the culture and the health of our workplace. And Karen said it, it's not just the leaders, it's everyone. And so I'm often told when I'm teaching the mental health first aid classroom, you know, oh, well, mental health and wellness, that's HR's role. But it's got to be more than that. There's got to be a paradigm shift here where we're starting to believe and we're starting to lead our actions into having everyone care about mental health and workplace wellness. And so at St. John Ambulance, we really do, and you see it there, we believe that it is everybody's business to care about mental health and wellness in the workplace. And so we're going to give you some simple ways to do that. And I'm also going to encourage each and every one of you on the call to look into different organizations in the community that provide mental health and wellness training for the workplace, because it is going to be crucial. It certainly has always been important, but I think post-pandemic, it's going to be crucial. And so some of the work conditions that you see here on the screen are conditions that will affect workplaces positively or negatively. And with the COVID-19 economic impacts so predominantly on our minds right now, we ought to remember that at an unprecedented pace, both our work and our life balance has been shaken up a little bit. And in the last couple weeks, it's become very apparent that some people are struggling to maintain their mental health and wellness and their resiliency at work. And as a result, we will likely see, if some of you are not already seeing, you know, productivity affected in our workplaces because of the impact of negative mental health. And so it is important to recognize that there are approaches that we can take to keep ourselves well and to keep our businesses well and healthy, so that post-COVID, we can have an economic rebound. Now, many of you do recognize St. John Ambulance to be a provider of physical first aid and CPR training. And we certainly do that, but we also really want to bring the message to workplaces in Ottawa and our community that we are a very venerable organization, and we're really rooted in innovation. And so what we've been doing, we've existed for hundreds of years, But what we've really been doing is looking at the needs of Canadian workplaces. And as a result, it was introduced earlier by one of the speakers, you know, St. John Ambulance teaches physical first aid and CPR classes, but in every single one of those physical classes, we have a component that is for mental health and wellness in the workplace. And we have a component that actually speaks to opioid overdoses as well, because St. John is recognizing that these items are critical in the community, and we reach, you know, 500,000 people across Canada every year with our training. So why not start to educate them on mental health and wellness? And we also do have, you know, specific curricula that deal with mental health. One that deals with mental health specifically in the workplace, and the other is a mental health first aid program that we run through the help of the Mental Health Commission of Canada. And so we're not going to get into the nuts and bolts of these courses. Rather, we're going to give you some tips and tricks to help you support your workplace. But I will make myself available after the webinar to make sure that you and your business are able to look to community partners like St. John Ambulance to provide mental health and wellness training for your workplace. Now, the other concept, I guess, when we look at the importance of mental health and wellness in our workplace is the financial or the economic impact. And we can't deny that money talks, especially in a post-pandemic economy. And so this here is a series of well-known statistics in the mental health and wellness world. And we can't help but see in these numbers, for example, today, there are 500,000 Canadians that are missing work this week because of mental health related problems. Or if we put a price tag on that, over $50 billion of economic impact due to mental health conditions. And this was prior to the pandemic. So you can imagine that if we don't start talking about this now and we don't learn some practical approaches to help in our workplaces, these numbers could become staggering, even more so than they already are. And so with proper training, with proper knowledge, you know, we can make sure that mental health injuries in the workplace are less disruptive. And we want to make sure that business leaders, HR professionals, and the workplaces that are attending today know that it is critical to talk about workplace mental health because it will have you with a stronger workforce if you're paying attention to these key messages. So the first concept that I'd like to introduce you to today is the Mental Health and Wellness Awareness Guide for the Workplace. And this is a concept that was developed in partnership with the TEMA Foundation and St. John Ambulance. And this tool is really, really easy to remember if you think about the gas gauge in your car. The concept of the gas gauge in our car takes us from full to empty. And the farther we go and the more fuel we use, the sooner we have to stop and refuel. And if we think about that and we look at that in the context of mental health, it's not always so easy to recognize when our gas gauge is maybe getting a little empty. And so this is what this tool is designed to do. We're going to be looking at this Mental Health and Wellness Awareness Guide through the eyes of a supportive coworker, which will enable us to identify if someone is resilient, struggling, in a worrisome phase, or in a distress phase. We're going to help you identify what those phases look like. And so remember, just keep in mind that analogy of the gas gauge. We're going from full to empty. The one, I guess, important concept to remember is that as people, you know, we don't have the gas light to come on to blink at us to say, whoa, we need gas. And so in mental health, we need a supportive coworker to actually be that gaslight. We need that person to recognize that potentially we don't have optimal mental health right now. And that supportive coworker can then start discussions in the workplace when someone has a mental health injury. So let's move on. We're going to dive right into this tool. It's going to help us recognize how to identify these phases and helpful strategies and tactics to use when we identify someone is in a particular phase. So the first phase of this model is the resilient phase, and this is where the gas tank's full. This is where we want to be. This is our goal. But we have to recognize that although this is the goal, none of us are here 100% of the time. And that's okay, especially, you know, in something like a global health pandemic. So this is the goal here. This is an actively contributing employee in your workplace. And how do we know that they're resilient? Well, we often see that they're able to easily manage their workload. They have a good work-life balance. I think about my coworkers, and I often see things like the lunchtime walks and whatnot. And I know that usually happens on an everyday basis, but it especially happens on a stressful day. And so these are the types of people that are resilient in our workplace, and they have the capacity to support other people. And if we're recognizing in our workplace that someone is in this resilient phase, this is a very good place to be. Again, this is the goal. And so everyday challenges will empty the tank a little bit. But in order to stay here in this resilient phase, we really want to encourage maintaining resiliency. And you can see some tips on the screen of how we would suggest that someone maintain their ability to be resilient. And I want to speak to bullet point number 3 there, where it's talking about focusing on activities that promote passion or enjoyment in life. And if someone in the resilient phase was able to really focus on activities that they're very passionate about, this often builds their resiliency. And we start to see this person have an even bigger capacity to help other people. So that's a tip or a trick that you could give to someone who is doing well, is to really encourage them to continue on with what has them feeling passionate. Because again, it's going to build up the way they're feeling, thinking, and acting. And those are the pillars of strong and positive mental health first aid. Now, as we work our way through the gas gauge here, we're now at about 3/4 of a tank. We're in this struggling phase. And we know at this point, with 3/4 of a tank of gas, we don't have our fullest capacity. However, we also know that there's time to get to the gas station and refuel. So often, the struggling phase is identified or exemplified by the mindset of, this is a tough time, but I'm going to be okay. And I think that, during this pandemic and sort of the economic impacts that this is having on so many of our organizations, some of us might find that coworkers are in this struggling phase. It's hard right now, but they also might still have that mindset of, it is going to be okay, and this is going to pass, and we are going to get through this. Now, the signs and symptoms of how to recognize that someone would be in this struggling phase, potentially they would have an absence from work or increased absences from work. They're still completing their work, but maybe with a lot less enthusiasm. You could start to see stress levels rise, and you might see that people are struggling to meet that work-life balance. And, we said it before, it is difficult in a virtual world right now to start to recognize these things in our coworkers. So I made some specific notes to talk to, the virtual or digital world that we're living in and working in right now. I'm thinking to myself that, some of the signs and symptoms that would indicate that someone would be struggling is that they are slow to acknowledge or complete their tasks. A lot of what we're doing right now is over email. So they're slow to acknowledge or complete their tasks. They may not be as engaged with the team. And we might be seeing their stress levels rise and their worry and their anxiety. And we might be sensing that through conversations we have with them in a virtual format or over email, the tone that their email comes through, or even through calls. So those are things to work and look out for right now. Some tips and tricks to help us, helpful strategies in this struggling phase. Really, self-awareness is key here. So if as a supportive coworker, we can help someone to recognize that potentially they are struggling, this will really be to their benefit. This is also where we could engage support systems. Often things like digital resources, self-help resources are a really good strategy in this phase to help someone who's struggling. Every time I'm in the mental health first aid classroom, I hear people talking about the app called Headspace. And I'm sure some of you on the call are familiar with it, but it's a free mindfulness app, and it actually has workplace specific content. And one of the great things about Headspace is they really promote, from a workplace perspective, happier people are happier businesses. Healthier people are healthier businesses. So these strategies of self-help in a digital world might look like apps that someone could use in this struggling phase. When I recognize that someone's struggling, I often go to bullet point number 2. And I really try to empower them and support them through this phase when they're struggling. And what that looks like is often we have conversations around what's within their control and what's outside of their control. And we want to focus on what's in their control and then setting small, manageable, and consistent goals to start to accomplish things. Because we all know, I mean, if you're like me, how many of you have a checklist going, right? And lists of things to do. And it feels good when we have small goals or big goals and we get to check them off that list. And so when a coworker is struggling, we recognize that, let's slow things down. Let's talk about what's within their control, and let's set small, manageable goals that they can consistently feel positive about because they're accomplishing them. As we continue to go, our gas gauge is getting a little emptier. At this point, we know we have to go to the gas station. When the gas is getting too low, we've got to go, we've got to get help. And often what this looks like in a mental health context is you are worried about your coworker. There is something, a behavior, a thought, an action that you are worried about. And so if you're worried, that's the time to act. This is really the time not to shy away from having a conversation with a coworker. Now, in the worrisome phase, a coworker may have things like an increase in substance use. You see it there on the screen. And that might be hard to figure out when we're meeting in a virtual boardroom. You know, so for example, in a regular workplace, we may see substance use coming out in signs or symptoms like the smell of a substance, the smell of alcohol, for example. But it's harder to tell whenever we're all working at home. So perhaps potentially we look for signs and symptoms like slurred speech instead of the smell of alcohol. Because again, in this virtual world, it's harder to recognize the signs and symptoms. Now, we also have on the screen presenteeism. And I know some of you will be familiar and probably have already completed workplace training, you know, in regards to absenteeism and presenteeism. But I want to speak to that for a moment, because presenteeism is that, you know, the coworker is at work, but there's feelings, thoughts, or actions that are worrying you about this person. Because they're completing their work under suboptimal conditions. They're at work, but they're not healthy. And again, how do we recognize this in someone? Well, if I turn to signs and symptoms, we may have someone who is perhaps isolated. And what does that look like in a digital world? Well, maybe when they're coming into meetings like this, they always used to use their camera and turn it on, but maybe they don't anymore. And perhaps when they do turn their camera on, all of a sudden you're noticing a really unkept appearance or a really unhealthy appearance. These are things to note and things to look out for. They may be arriving late to meetings. They may have a lack of, you know, self-awareness or time. They may not be participating in these meetings as much. It's a challenge to notice it digitally, but it's not impossible. Okay. Now, what do we do? If we're worried about our coworker, it's time to get help. And help looks different for everybody, all sorts of different types of help. And so often where help can successfully be found in a workplace is turning towards something like a benefits package or an employee assistance program if you have one. And I would encourage all of you on the call, whether business leader, owner, or employee, look into benefits and employee assistance programs that would be available to you. Because not only can it help support you, when you're in the hot seat and you have an opportunity to support another coworker, you know what's immediately available. Professional supports can also be used here, and professional supports might be a medical doctor, it might be a mental health practitioner, but certainly if we are worried enough to come to a coworker and be worried about their mental health, likely we're going to need some more types of support. Now, when you're worried about your coworker, to kind of return to our analogy there of the gas gauge for a second, your job here is to be the gaslight. Your job is to, you know, help this person become self-aware that they are struggling and that they've got some worrisome signs and symptoms of mental health injuries happening. Because a lot of times people might be completely unaware. Now, as we get down to the last phase in our guide, this distress phase, the gas tank is empty here. And often when my gas tank gets empty in the car, I wonder, how much further can I really go? And so if we look at that and we bring that into the context of mental health and wellness for the workplace, some of you might recognize these signs and symptoms as burnout. And potentially you've been there before, potentially you've had coworkers that have burned out before, but this is really starting to tip into the absolute negative aspect of mental health and wellness in the workplace. Now, what we can do is we can certainly support a person through this stage. And again, in order to do that, some of the tips and tricks that we would encourage you towards are helpful strategies that don't differ much from the last stage where we're worried about them, the worrisome phase. We're really needing at this point to engage in professional help or medical help. I mean, if I go backwards with the slide for just a second, and we look at things like suicidality, we need help, okay? And so we want to make sure that we're encouraging that person to reach out to supports, and potentially we may even need to encourage them towards certain supports because they might not know where to get that support. The 2 points on the screen that I do want to speak to in a little bit more depth are the 3rd and 4th points, because I want you to remember that it's really easy for us to say something like, make a plan and follow through with it. It's just as easy to say, don't have a heart attack. But the reality of it is, we know we can't stop ourselves from having a heart attack. And often, if your coworker is in the distressed phase of this model, they may not be capable of making a plan and following through with that plan without support. And that support may come from you, it may come from the workplace or EAP or friends and family and a doctor. Okay, remember, support looks different for everyone. So throughout this distress phase, you can definitely support and engage others, and there are some helpful strategies here listed on the screen for you. Okay, but help is definitely needed. Now, one of the other things I want to speak to is that oftentimes we hear when we're teaching in the mental health classrooms is that where do I draw that line? When is it my turn to stop helping, and when do I turn it over to someone else? And there's no right or wrong answer to that. And that really is going to be based on the relationship that you have with that employee or with that coworker. But what I do want to say is that please don't feel it is always your role to support them. Make sure you remember that tagging in people like friends and family and medical support systems is always a good idea when we get to this worried or distressed phase. It doesn't have to just fall on us. Okay. So let's talk about what we can do. Other strategies and a model of support that's going to be, fairly easy for you to remember and to use in your workplace. The TEMA model of support that you see here is designed to help you specifically identify and support struggling coworkers at work. And so you can see the steps there: take action, engaging in conversations, making meaningful connections, and accessing help. So 4 different areas of this model of support that you can use to help a coworker. Now, I want to make sure we be really practical about this and we bring this into real life. And I don't think mental health support often ever looks like it goes in this, really nice system that we have here on the screen for you. So I have to really make sure that we say, this is not a cookie cutter approach, and we don't need to follow steps 1 to 4 with each and every person. We have to be realistic, and we know that relationships in the workplace are different. And so, for example, you may have acquaintances and you may have coworkers that you're very, very close with. And the support, how you support and the degree of support will definitely change. So the good thing about this model, and let's remember, is that the TEMA model of support is demonstrating a logical sequence, but luckily it's not carved in stone. So as the supportive coworker, you get to take these 4 actions and you get to use them how you want to and to the degree that you feel comfortable. Okay? Because if you're the one supporting, we need you to feel comfortable and confident to keep supporting. So if we look at our first step of taking action, we really want to make sure that we're looking to see and identify what types of different behavior or worrying behavior are we seeing in our coworker. And once we see that, we're probably going to recognize there's a need for help. And what we need to do is sort of assess what that individual needs. And so, for example, it could be something as simple as that individual might just need to sit down with the listening pair of ears and talk through a problem. Or it could mean that that person needs to seek immediate medical attention because their mental health crisis is at a state where it's dangerous. Okay? So assessing the situation. And then formulating a game plan. What do you need to do, and how far can you take the support, and who will you engage after your support is done? Action number 2 is engaging in a conversation with the person. And after we've decided to take action, we've sort of recognized that something about this coworker is worrying us, we're going to take action. We're often left with the question, how? How do I have a safe, healthy, and respectful conversation about mental health in the workplace? And that's often a question that scares people. And I really want to make sure that I encourage you and to know that having difficult conversations at work is never easy. They're always difficult. And often mental health conversations are difficult and they're tricky. But we have to kind of take that courageous step. And if we've recognized a coworker who may need help with their mental health and wellness, we take that courageous step. And I would encourage you to one of my favorite techniques is using what we call I messages or I statements. And this is, again, one of those key takeaways. It is going to help you get this conversation started. So, for example, I might say to someone, I've been worried about you lately. You haven't been contributing to the team like you usually are. Is there something that's bothering you? And that's a really subjective way of stating my own feelings. It would be very different if I said, geez, Karen, you've been absent lately and you really haven't been paying attention at the meetings, and what's wrong? Okay. I messages bring that to me. I might say, Karen, I'm worried about you. I've been noticing these behaviors and I'm wondering if everything's okay. And so that subjective approach will often show more compassion. It will also show more acceptance. And, it shows that genuine concern. I've noticed, I'm worried, I'm concerned. Okay. That's often a very successful technique at getting these conversations started, which is sometimes the hardest thing to do. Okay. So, of course, when we start that conversation and I say, I'm worried about you because of X, Y, and Z, we know that that coworker could throw up a wall. And they could say, you know what, no, I'm not having this conversation, it's not appropriate. And they could just really tell us, oh, I'm fine. Nope, everything's good. Don't worry about me. If they throw up that wall, it's okay. When they throw up that wall, 2 things are going to be needed: patience and persistence. But we ought to remember that oftentimes mental health problems didn't develop overnight, and they're likely not going to be solved overnight, and likely not in one conversation. So if the very first time you approach them, or even the 10th time you approach them, they're still putting up that wall, perhaps think to yourself, maybe this is not the right time for them to talk about this, or perhaps you're not the right person. Okay, but by engaging in this conversation, it allows you to see whether or not they're going to be receptive to further help. And if they're not receptive to further help, patience and persistence, and we might have to tag someone else in. So imagine going to a coworker who knows this person better. And you go to that coworker and you say, I've recognized that Jane is just not herself lately, and I know you know her really well, and I'm wondering if you've noticed anything. And having that conversation in the sideline with a coworker who could now go support. And perhaps that employee, Jane, now opens up to that second coworker. Okay? We want to encourage you to know that maybe it's not the right time, or maybe you're not the right person, but there are ways to support. Okay? Now, if we think about making meaningful connections, if we're going to be getting into the nitty-gritty of it with coworkers, we really need to make sure that they're trusting us and that we do have a connection to speak to them. And again, perhaps if you don't have a connection and you're really having a hard time making a connection, finding someone that does have that type of good rapport may be very helpful in the workplace. One of my favorite tools to use when we're talking about making meaningful connections is nothing groundbreaking or earth-shattering, but it's the concept of love. And so if you look here on the screen, listen, understand, and validate. And again, this is one of those easy to use tools and easy to remember tools. And in order to connect with just about anyone, coworker or otherwise, the love method often won't steer you wrong. By listening and trying to understand someone, we're really giving them the time and the space to tell us what is bothering them and what is challenging their mental health and wellness at this time. Okay? And often with these discussions, we then move into that validation piece where we've listened to them. We're trying our best to understand. Maybe we don't agree with, but we're trying our best to understand. And we can often validate them by saying something like, you know, this is a normal reaction to an abnormal circumstance. I mean, we look at how many people right now in our workplaces, in our community, may have mood-related disorders that are and have been festering for, you know, those last 7.5 weeks that Suling was talking about, right? Even just because of the COVID pandemic. We look at an increase in mood-related disorders. And what that means is that often this is a normal reaction to a very abnormal circumstance that we find ourselves in right now. And so validating that for someone can be very powerful in conversation. Now, accessing help is another big issue. And so this is part of our TEMA model of support. It's the fourth and final step where we'd be looking to engage in some type of support, whether that's benefits package, EAP, or I actually have some helpful resources here I'll put up on the screen that I've collected over the years in mental health first aid classes. And this comes from people who are successfully using these types of resources, and they're your employees. You know, so myself, I've used the Insight Timer most definitely and the Headspace app. So certainly I can vouch for a couple of those to let you know that they are really ways that we can find sort of that self-help element. And potentially we also need to go to other resources. So some of the ones that St. John loves to recommend, things like the Mental Health Commission of Canada, really great website and an organization. And so they're the ones that bring the mental health first aid classes to our community, and St. John is partnered with them to deliver that. But they have tons of great resources on their website, COVID specific resources, but also workplace mental health specific resources. So a really great place to go to learn more. Same with that second one, the Not Myself Today campaign. I'm not sure how many people on the call today have ever heard of this campaign, but if you have not, oh, I see Karen, she's shaking her head. It's pretty awesome. And so that Not Myself Today campaign is really something I'd encourage you to look into, because it's really a great way to promote mental health and wellness in your workplace. And then number 3 there, we can't help but overlook community resources that are available. So if as a coworker, we can't support, or we don't know what to do, or the situation is getting pretty critical and we're not sure what our next step is, engage people like the Ottawa Distress Center. Engage community supports that are there available 24/7 English and French to support you or the struggling coworker through all types of mental health related problems. So that accessing help piece is really good. And, you know, steps 1 and 2 are things that you can do proactively to prevent, you know, mental health and wellness breakdowns in your organization. But then when all else fails and we need help and we don't know what to do, rely on the community resources that are available to you. And the last thing that I want to leave you with before we go is something that I challenge all of you with today. And then we'll get into our question period. So what I'd like you to do is, after we're done on the call today, I want you to grab a hold of your calendar and start today. And for the next 7 days, Write one thing per day that you can do for yourself to fill up your own gas tank. Okay. We want to make sure that we build resiliency in ourselves so that as business leaders and organization owners and even the HR professionals that are in the room today, we want to make sure we have that resiliency to be able to go forward and to help those that may be struggling in our workplace. And you can see some of the recent examples that I've done just for myself. These are the sorts of things that help me fill up my gas tank, especially the second one, going outside. All right, Lynn, well, I'm going to turn it back over to you.
Right. So first, I want to say a heartfelt thank you to Lisa for doing this presentation for us today. This was a topic that was near and dear to my heart, and I am just delighted that we were able to schedule it during Mental Health Week. So Lisa, thank you so much for that. I'm going to give Lisa a chance to rest her voice for a moment or two. And I just want to update you about some of the upcoming webinars that we're doing at the Ottawa Board of Trade. And they, again, like this one today, they are open to absolutely everyone. I know there's a few people in the HR profession joining us today. You might be interested to know that tomorrow on at 11 a.m. we're doing a webinar with the Business Sherpa Group on the opportunities and challenges in the talent market for SMEs. Next week, we're doing on the 12th, the 3 roles of a business owner. On the 14th, we're talking about communications and marketing in the COVID-19 environment. On the 19th, business continuity planning, which is very, very important these days. And I'm really excited to share with you that on the 20th, for our next Wellness Wednesday, we're going to have Dr. Vera Etches from Ottawa Public Health join us. And the theme of this particular Wellness Wednesday is Get Outside. And Dr. Etches is going to talk to us about how we can do that and still respect the physical distancing guidelines, what kind of activities we can do, and the importance of combining mental and physical health for our overall well-being. So I'm pretty excited about that one as well. I also want to take a moment right now to thank our sponsors, the Ottawa Citizen, St. John Ambulance, of course, and IHR Advisory Services. We cannot host these kinds of events for our members and guests without their ongoing support, and we are eternally grateful to you all. So, Lisa, are you rested and ready for some questions? We need you to unmute.
That would be helpful.
That would be very helpful. So I'm going to take advantage of the fact that I'm the host to hijack the question period and start with my own. So what do you do when you're talking to a colleague and you've expressed your I statement, I am concerned, I am worried, and they shut you down right away? What would you recommend as the next best step in the workplace to address that kind of issue?
That's a hard one. You're right. That's sort of where they're throwing up that wall, right? And if we were in the middle of that conversation and we had shared our worries and our concerns and they were not willing to engage in that conversation, I would probably, take those social cues, Lynn, and make sure that we end that conversation respectfully, because we don't want to overstep our boundary in the workplace, but perhaps end that conversation, just letting that person know that, perhaps you were mistaken, but you just had recognized a few things that really worried you, and you at least wanted to bring it to their attention. Because what that's going to allow them to do is go back and think about that. And you've now planted the seed that perhaps maybe they are struggling and people are recognizing, and if I do need help, I think I might go back and talk to Lynn because she asked me about it.
Okay, that's good to know. I see that we've just gotten a question from Stephanie. And Stephanie, I'm actually going to ask you to unmute yourself and ask the question because I'm not sure what that acronym stands for.
Hi. So first aid mental health training. So I was wondering, when people do the standard first aid training course, how in depth does it go for this training or this knowledge acquisition?
Yeah, that's a really good question, Stephanie. So the way that the standard first aid course is structured at St. John is that there is a total of 19 different modules that we cover over 2 days. And so mental health and wellness is one full module. And typically we're speaking and sharing a bit of a simplified version of this presentation. And it's, you know, typically anywhere between a 30 to 40-minute conversation in the classroom about how to support someone's mental health. So it's one entire module in our course.
Okay, thanks.
And you have the 2-day program as well, specifically.
Yeah, that's right, Lynn. So we do, we have the 2-day mental health first aid course. That's the thing, is we all have to get used to the terminology of all these course names, but the mental health first aid course is developed by the Mental Health Commission of Canada, and we certainly run weekday and weekend sessions here at the office in Ottawa for public clients who want to come into the training, or for workplaces as well. We'll invite your workplace to our training center to do that training, or we will come to you as well for 2 days. And that course is really comprehensive. It talks about the 4 most common mental health disorders in Canada, and even talks about crisis first aid components for things like suicide or panic attacks.
Oh, that's really interesting. I had no idea it went into such depth. That's amazing. I don't think there's probably a person on this call that hasn't at some point in their life had someone in their network or their circle or their family who has had a mental health problem of some kind, and we're simply at a complete and total loss as to how to deal with it, or how to provide the support, or how to help them get the right help that they really need. So, you know, again, I'm a huge advocate, so sign up your businesses. Sorry, I had to add that. So we have another question that's just come in from Jason. And Jason says that it seems that MHWW is a peer-based support compared to the MHFA. How would I know which one is more applicable to me?
Yeah, that's fair. Really great question, Jason. Thank you. So the mental health and wellness for the workplace course is the 1-day course that's run through St. John Ambulance. And it is a peer-based program. So we're really looking at how would I identify a problem in my workplace and how would I support that? And that's a lot of the little sneak peeks that we saw today in today's presentation. And so for businesses and workplaces that want to really increase the culture and the health in their workplace and get the employees supporting each other, the mental health and wellness for the workplace course is certainly, you know, what we would recommend to you. The mental health first aid course, very good, very comprehensive. It's 2 days, 2-day course. And it's really going to look at, you know, laying a foundation of disorders, how to recognize them, and how to support them. So it's certainly a lot more clinical. We often see businesses and companies engaging in that sort of training that have that clinical background and that need to know the you know, the criteria for diagnoses and whatnot.
Did that answer your question, Jason? You can take your mic off if you want to follow up with anything.
Yeah, no, that's perfect. Thank you very much.
Great.
No problem. I think, Lynn, what I'm going to do is I'm just going to share my screen there again for a second, because
Absolutely.
I want to put up our contact details, because I'd be more than pleased after the session's done as well to make myself available to answer questions that businesses have to help people know what type of training is available through our organization, and encourage you to look at other organizations as well. But you know, more importantly, to help businesses and organizations learn what type of mental health and wellness training is best for their needs.
Awesome. And I also would like to take a moment and ask you, Lisa, to share with our audience, since we can, about the PPE drive tomorrow, or on Saturday.
Oh, sure.
Sorry.
Sure. Okay. Oh, excellent. Thank you, Lynn.
Oh, you're welcome. It's important.
I mean,
So,
the mission of St. John Ambulance is to help improve the health, safety, and quality of life of people in Canada. And we're recognizing that with this COVID crisis, the quality of life and health and safety of our country and Canadians is really suffering. And so St. John Ambulance is really proud to partner with Conquer COVID-19 and the Ontario Medical Association. And we've been running community PPE drives where you can come to St. John Ambulance this Saturday between 9 and 5. And you can drop off any sort of personal protective equipment that you or your organization might have in excess. So gloves, masks, goggles, face shields, anything like that. Heck, we've even had people drop off ponchos because they can be used in a pinch instead of a medical gown. And what we do with that is we work with Conquer COVID to identify needs in our local community, and we redistribute that to hospitals, healthcare clinics, physicians, and community organizations like shelters who are in such critical need of PPE. And the second portion of what we do is in working with Ontario Medical Association, this weekend we're hosting a drive-by PPE distribution center. So that means the doctors get notified that we have PPE and they can drive by St. John Ambulance and we can safely maintain our distance while giving them most often the face shields and the masks that they so critically need in order to keep seeing patients in our community. So it's that's happening this Saturday between 9 and 5 at St. John Ambulance.
thank you, Lisa. And I didn't mean to put you on the spot about that, but I just think it's a really important initiative. And again, you know, the Ottawa Board of Trade firmly believes that we can only protect the economic health of Ottawa's business community if we keep our workforce safe and healthy as well. So we are very, very close to the end of our webinar time. And so I'm curious to know, Karen Brownray, as an HR professional, what were some of your biggest takeaways from this webinar today? What really struck a note with you?
I think what struck for me was the really great tips that were provided today about the signs and then the how. So if I see this sign, how might I broach that? And it was done in a very respectful way. And also what Lisa said about, you know, planting a seed and just being there for someone. Sometimes it's not, actually I would argue most of the time it's not about solving it for someone, it's about being there for someone. Also, a lot of the things that we see when we're supporting clients on the HR side of things is people are so worried about all of the landmines around maintaining privacy and accommodations and all of the due process steps in accommodating in the workplace. And I think this busts the myth, right? Having this kind of training allows people to understand that it really comes down to something that's very simple, and it's about listening and being there for someone and being open to having a conversation and not having a predetermined outcome or not trying to fix something for someone. So it's really great. I think it's not a one size fits all ever, as Lisa was saying, and it's just the beginning, and having the ability to at least take that step forward and put your hand out and offer support to someone, or maybe elbow whatever. And during the pandemic, I think it was really great. So I thank you, Lisa. That's just phenomenal.
Those great observations, Karen. Thank you so much. Because I knew that the nature of today's webinar would be, for some people, perhaps personal or difficult to discuss with in person, Lisa graciously made the offer to talk to anybody after the webinar. You've seen her contact details. You can reach out to me for them. But if you have any questions, please do not be shy to reach out to her to follow up. She will be more than happy to assist you. And on that note, unless we have any further questions, I think we can adjourn for today, but I want to thank everyone for joining this conversation. I think it was a very important conversation to have. And Lisa, what a marvelous job you did. Thank you so much.
Thank you, everyone, for joining us.
All right, so as soon as the webinar recording goes live on our website, we will send you all a little email to let you know that it's available for your viewing and for sharing. And thank you so much. And Don't forget to do your journaling for what kind of things you're going to do to keep your gas tanks full today. All right. Have a great afternoon, everybody. Thank you.
Bye, everyone.